This tape is the solution to the healthcare crisis in America. And it comes from a personal point. My father was a vascular surgeon, Harvard-educated surgeon who worked in Colombia, South America. He was very respected. He was published in the journal Surgery. I personally saw him moderate a meeting with 800 surgeons, along with two other peers. There are three older physicians moderating 800 physicians. Many physicians were talking about the new surgeries, new procedures. It was a very high level surgeon meeting here in Miami. And I had the opportunity of visiting with my father doctors, peers that he had in Chile, Brazil, and in Argentina. And it was funny because, you know, all the doctors in America here at Ventura Hospital, for example, you know, the parking lot of the doctors is all Mercedes-Benzes. And what's funny is all the doctors in South America, all the surgeons in South America were driving in the equivalent of Toyota Tercels and not even Toyota Corollas. And it just made me realize, you know, doctors love being doctors. When you pay a doctor less, they don't stop being doctors. They don't become plumbers or electricians. To be a doctor is a great honor, regardless of the money. They don't do it for the money. In the United States, the American Medical Association has become a moneymaker, and you know that's when you see the doctor and you have a 10-minute visit and it's $500. And you know, I went to the emergency room 10 years ago with a fever, and they gave me a Tylenol and a bill for $1,500, and it's monopoly money. And you know, it used to be that doctors were different, but over time, with the American Medical Association and so on, whatnot, it just became a business. So, my point is, if we import doctors from India, they all speak English, or from other lands that speak English, we could import 10,000 doctors at a time that love to come to America, and then we don't have to be paying our surgeons and our doctors $500 for a 10-minute visit, which is really the problem. You know, same with the nurses. You know, when we're paying doctors $500,000 and nurses 80 grand, of course, you know, the whole thing's out of control. People say, well, you know, doctors are, we don't have enough doctors. Not true, okay? I personally saw doctors in these international conferences. Go to an international conference of surgeons, and you will see very motivated surgeons from Europe and from South America, just as motivated as the American ones, but instead of making $500,000 a year, or $2 million a year, or $3 million a year, these doctors in other lands make $20,000 a year, $50,000 a year. You know, they sit in the same chairs, they talk about the same drugs, the same procedures. And this is something that in this country, you don't hear it, okay? It's like, oh, we need to protect whatever they want to charge, and it just got out of control. They're like, you know, baseball stars, and they're charging whatever they want to charge, and you know what? There is an alternative. The alternative is to import doctors from other lands. Now, if you're concerned that the quality is not there, know this. So when you get into a, God forbid, traffic accident at 3 or 4 a.m., the radiologist reading your scan is an Indian radiologist that's up at 4 a.m., and he's looking at that CAT scan, and he's saying, yeah, you know, I see a hematoma, I see epidural, I see blah, 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 you know what I mean? So if the radiologist from India is reading your scan, it's good enough for us at 4 a.m., guess what? It's good at 4 p.m. The difference is the radiologist in India is making, you know, 30, 40 grand a year, and the radiologist in the U.S. is making $500,000 to $1 million a year. That's the solution. You heard it here, for real. And one more thing. My father, he saw how the HMOs went into Colombia, and in Colombia, South America, the HMOs paid dirt, and he stopped making money. And he didn't care. He continued being a surgeon many times, working for free, operating on the poor for free, and so on. My point is this. I'm not asking to pay our doctors nothing, but my point is, if you fear that doctors are not going to work when you lower their salary, you're dead wrong. Doctors have nowhere else to go. There's no better feeling than cutting into, you know, the flesh of a live person and saving their lives. Doctors are not money motivated. We've made it so that it's become a business of money. The insurance companies did it. But it doesn't have to be. We can bring back our doctors to be patient loving and medicine loving instead of patient loving, medicine loving, and money loving. Because you see, then we can afford to insure the 50 million Americans that don't have insurance. Import doctors from English speaking lands, and the quality's still there. And I've seen that. To prove it, you can prove it to yourself. You can go to a international conference of physicians anywhere in the United States, New York, Miami, or LA. Go in and talk to look at the foreign doctors from other lands. See how they speak to the American doctors. And these doctors from foreign lands are making a tenth of what our doctors are making. Do they look stupider? No. Many times they're more creative. So that's it. That's the solution. And you heard it here. And it's something that I don't see often, you know. We're afraid that we're not going to have enough doctors who want to be doctors. No way. We can have instant doctors come in, they can take a test. Doesn't have to be like the harrowing test that it is, because, you know, that's all it's doing. It's filtering. It's a terror. It's a horror that not even our own doctors would pass. You know, it's a test for the sake of a test. And look, medicine up to now has been a business, and we can change the business. Thank you for listening to me.